The normal process when someone comes in these circumstances is to stabilize the patient and then do a wide range of diagnostic tests. And that was what was done by the team at Apollo, and it was that first round of tests that identified the infection in the blood, that process in the first few.
That copy of the summary.
Good afternoon, everybody. I am Dr. Balaji, Professor of Minimal Access Surgery at Madras Medical College, who was appointed as the government coordinator to coordinate the treatment activities of the Honorable former Chief Minister of Tamil Nadu, Madam Selvi J. Jayalalitha, when she was admitted in Apollo Hospital. Madam was admitted on September 22nd, and I was given an order on September 23rd to oversee the treatment activities by the government. And here I present to you this the basic reason for this press meet is to dispel some of the rumors that are afloat as to regards what was the treatment given to her, what was her condition during her admission. And so I present before you Dr. Richard Baley, the specialist from United Kingdom who had come to treat our Honorable Chief Minister of Tamil Nadu, Madam Jayalalitha, and Dr.
I think many of you know. And the purpose of our meeting is really to try and clarify some of the misconceptions that seem to be around about the care of the late Honourable Chief Minister. Now, of course, Dr. Babu and I are physicians. We can only give a certain amount of information because of the necessary confidentiality and dignity that must be respected. And of course there are other processes running here in India which must also be respected. But within those constraints, naturally, we will do our best to answer questions. Now, the way we thought this might work is we don't have any prepared statement or anything of that nature, but if you will address your questions through me as if I were the chair of this meeting, then what we will do is one of us will do our best to answer them. And I'd be grateful if we can keep the noise down at the back, please, gentlemen. And if we can make sure we don't have mobile phones on loud at the moment. So if you could put your phones to silent if you've got them, so that we can respect the occasion appropriately. Okay, so I'll take questions based on shows of hands. We're going to take as long as it takes. So I'm afraid I don't know any of you, so I don't know which journal I should or shouldn't prioritize. Therefore, it will be potluck where we go. And I think the first hand I saw was over there. Would you say who you are, sir, so that we know who you're representing?
He wants you to introduce yourself.
Yeah, my name is Vignesh.
Please wait for the microphone.
Yeah, my name is Vignesh. I'm from Sun News. Yeah. So can we get a timeline on the treatment that was given to the Chief Minister, and what was the exact treatment that was given to the Chief Minister?
So I will pass that question over to Dr. Babu in a moment. But of course, we're not going to go into more than a certain amount of detail for the reasons I've already alluded to. But in broad brush terms, we'll provide the timeline. Dr. Babu.
Second, if I'm not mistaken, 22nd of September, about 10:30, and we declared a death on 5th of January 2016. So it was 22nd December. Sorry, I'm sorry about that. December. So 22nd of September 2016 to the last date that I mentioned, 5th of December 2016. And the care was, I can only in one word I can say, it's critical care, supportive care is what we gave her.
I mean, what was the problem she was suffering from, and what was the treatment given?
Okay.
And get to everybody. We just need to manage that slightly. But in terms of the problem she was suffering, so I think you are all aware of the sequence of events that she became short of breath at home and became very short of breath, and an ambulance was called and she was brought to hospital. And at that time the working diagnosis was one of respiratory failure, most likely due to infection. And I don't know how many of you are familiar with the term sepsis, but sepsis is the term that we use to describe the body's response to a serious infection. Now, when you get an infection, a serious infection, it provokes an inflammatory response in the body. So even when you have removed the source of the infection, whether it's an abscess that you drain or something you treat with antibiotics, that process has to continue and burn itself out. And that process of sepsis can and does cause damage across all the different organs, depending how severe it is. And so the process at work here was an infection resulting in damage to organs and contributing to the shortness of breath that the Honourable late Chief Minister was suffering from. At that time, it wasn't entirely clear what the source of infection was. There were a number of possibilities. The chest and urine were two strong possibilities, but subsequent tests showed that there was indeed infection in her blood. So bacteria were grown from the blood, and that was where the infection was identified and resulted in her general poor condition. And so that was the underlying problem. Sepsis, bacteria in the blood, and that infection ultimately also attached itself to her heart, a condition known as endocarditis.
I have a question here. My name is Sandhya Ravishankar.
Okay.
I'm in or overnight. So does that, am I right?
No, you're not, I'm afraid.
Okay.
So the sepsis can come on extremely quickly. Indeed, in the general sense, the mortality from sepsis is very high, and typically people become unwell in a matter of hours to days, to the stage where they require the appropriate treatment. And the longer treatment is delayed, the more serious the consequences. And of course, if someone has other comorbidities, and it is well known, I think, that that Madam had the diabetes and high blood pressure, and so these things contribute to an increased vulnerability for patients when they get severe infections. So it can come on very quickly, and its consequences can be severe. We'll take.
He just wants me to translate.
Okay, we'll stop for translation.
அவங்க கேள்விக்கு பதிலா செப்டிசீமியா இருந்தது, சீரின் தன்மை ரத்தத்தில் இருந்ததால், கோமார்பிட் கண்டிஷன் அவர்களுக்கு சர்க்கரை வியாதி இருந்ததாலும் இரத்த கொதிப்பு இருந்ததாலும் வாய்ப்புகள் உண்டு என்று அவர் சொல்கிறார். அன்கண்ட்ரோல் டயபெட்டிஸ் மெலிட்டஸோட வந்திருந்தாங்க வித் செப்டிசீமியா. டாக்டர் பாபு ஏற்கனவே சொல்லிட்டாரு. The best of treatment has been given to her in ICU with the critical care that was given to her. அவங்களுக்கு என்ன வைத்திய ரீதியில் இந்த உலகத்தில் சாத்தியம் இருக்குமோ அது அனைத்தும் மாண்புமிகு முதலமைச்சர் அம்மையார் அவர்களுக்கு செய்யப்பட்டது. எந்த அவங்க இனிஷியலா ஃபீவர் டீஹைட்ரேஷன் தான் வந்தாங்க சார். அவங்க ஃபீவர் தான் வந்தாங்க. அதுக்கப்புறம் அவங்களை இவாலுவேட் பண்ணும்போது அவங்க சுகர் அன்கண்ட்ரோல்டா இருந்தது. அதுக்கப்புறம் யூரினரி இன்ஃபெக்ஷன் இருந்தது. அது அப்படி செப்சிஸ் கொஞ்சம் அதிகரித்ததால் she went.
Please, can we just first of all maintain the order here, and remember that Dr. Baley was in a coordinating role, but he wasn't one of the treating doctors. So could we just take another question over there, please? One at a time, please. This gentleman with his hand up, about to have the microphone. So I'll pass that to Dr. Babu in a moment for the details, but the broad brush is that when she came into hospital with sepsis, infection, as we've discussed, then for a period of time she was treated with non-invasive ventilation. That's ventilation via mask to the face, and her initial condition improved somewhat, and she was certainly conscious and responding.
I will translate each line.
Okay. And then, unfortunately, as the sepsis progressed and she got more tired, it was necessary for her to go on a ventilator fully, at which point she was asleep. And then later in the course, as she improved, she once more was awake and fully interactive. But Dr. Babu will provide more detail and also in Tamil, perhaps.
The thumb impression was attested by me. Myself and Dr. Babu Abraham were in the room. அவர்கள் கை ரேகையை அட்டஸ்ட் செய்த நான், அதற்கு சாட்சியாக இருந்தவர் டாக்டர் பாபு தான். 27/10/2016 அன்று அந்த நிகழ்வு நடந்தது. I read out the letter from the election commission to her, and since there was அவர் கையில் IV fluid சென்று கொண்டிருந்ததால், அதில் கையெழுத்து போட சிரமம் இருந்ததால், கையும் வீக்கமாக இருந்ததால், அது சாத்தியமாக இல்லை என்பதால் அவரது கைரேகை பதிவு செய்யப்பட்டது. அதை நான் அட்டஸ்ட் செய்தேன். அதற்கு சாட்சியாக டாக்டர் பாபு அன்று அவரோடு இருந்தார். She was conscious. நான் அவரோடு பேசினேன். இந்த மாதிரி நான் டாக்டர் பாலாஜிங்க உங்க இந்த she read the election commissionல இருந்து வந்த லெட்டரை படிச்சாங்க சார். படிச்சுட்டு she was since it is not able to sign it, she attested the thumb impression, and I introduced, and Dr. Babu was also.
Gentlemen, please, we will take...
No, my question was, when did she turn unconscious? You can give the timeline.
With respect, this isn't going to work if you shout questions at us. We'll take as long as it takes, but I do insist that we do this in a civilized fashion. Sir, you had a question. Will you follow up with your point over there?
He is asked why no photographs have been released of the patient, Madam Chief Minister.
It is absolutely not normal practice to photograph people who are critically ill in hospital, or any patient for that matter, and publish that sort of private and detailed information about someone. It would be regarded, is regarded as an intrusion on their confidentiality and their dignity. And where I practice in London, it would absolutely never be the case that we would allow photography of any critically ill patient and publish their photograph unless they specifically wanted that to happen. And clearly someone who is unwell isn't in a position to make such a decision, and then later when they recover, then it's a matter for them, but one respects their wishes. So in the general sense, that's why this is not done. But Dr. Babu, you may want to comment because you were involved. Please let him finish.
But all along we were told, the media and the outside world was told that she was improving dramatically. You said she was critically ill, but all along that was not the picture that was.
Both of us can ask us medical questions. We'll be happy to answer. Unfortunately, we will not be able to answer those questions which are hospital policy or whoever the policy makers are. Please ask us medical questions. We'll try to answer, as Professor Richard Beale said, within the purview of her confidentiality. And you know there's a court case going on, so I will not be able to divulge everything. I can't answer that question of yours because it's not mine. Can I answer Sam, please? So, Sam, I cannot give you finer details or time or dates because I don't have records with me, and my memory is not that good. So when she came to us to the emergency room, she was drowsy, but with treatment appropriate, she woke up, she was talking, she was eating, she was interacting with officials for about a week, I would say, by which time, because her sepsis was slowly making her tired, her breathing was getting worse, she got intubated. That is, the tube was put into her throat so that she will be connected into a big ventilator. So once she was put on a big ventilator, then we had to give her sleeping medicines because otherwise it becomes uncomfortable for her. So from that time onwards, for about 10 days, she was on sleeping medicines and not able to communicate continuously. But when we remove the sedation and wake her up, she's able to communicate by signs, hands, because there's a tube in the throat. After that, we did a procedure called tracheostomy. I again can't remember the date off my head. After the tracheostomy, usually patients come off the sleeping medicine. They are fully awake. From that time onwards, I would say it would be about 10 to 12 days after we did the intubation. She was again awake and appropriate and communicating by sign languages, and we can lip read her. So most of the medical personnel could understand what she is saying by lip reading. That's all.
And you'll remember in the public domain, wasn't it, about the conversation I had with her where I said, look, in here I'm in charge, and she said, no, you are. She was still in charge. So she was very much completely aware with it, interacting in that phase. So the point about this is, at the beginning when she was unwell, clearly she wasn't in a position to interact clearly. She improved a bit, deteriorated again, was stabilized, and then later, as she was on a trajectory of improvement, she was very interactive and aware. So that's the reality of this process, and it's entirely typical for somebody who has this sort of situation.
Sir,
Madam at the back with your hand up. So I think it's worth understanding a little bit more about what happens in these sorts of disease processes, because a lot of the misunderstanding, I think, is because people just don't, and why would you, understand how things work. So when someone has had this sort of illness and is on the ventilator and then has been stabilized and is on treatment, the process we follow is we wake them up, we try and reduce the support from the ventilator, and we start physiotherapy. We try and start the rehabilitation process as quickly and as soon as we possibly can, because people who are sick lose muscle bulk, they lose strength, and so on. So you want to have them working as much as you can to try and encourage that improvement process. Now, that's managed by the physiotherapists, the bedside nurses, and to some extent the doctors are involved, although it isn't our primary skill set, and supported by the dietitian and all the other members of the multidisciplinary team who help with this. And so all these things go along at the same time. Physiotherapy isn't an all or nothing thing. It starts off very gently. There's that balance between not overstressing the patient, but at the same time making sure they're moving forwards and they're starting to regain a bit of strength. So that's exactly what happened here, in a very focused and skillful and meticulous way. And so she was gradually getting stronger. So to begin with, someone is lying in a bed, and a little later they can sit, and they can sit on the side of the bed with support, then with less support, then with no support, then they stand a little bit, then they take a few steps. This is the process, and that process was really going on from very early in her treatment all the way through to her tragic collapse, and completely unexpected collapse at the end. Now, why did that happen? We don't know, except we have a lady of more mature years with chronic diseases, hypertension and diabetes that make you vulnerable to these things, and with recovering sepsis, and who'd had an infection on her heart. So unfortunately, a sudden heart attack or stroke or some other event like this can, and tragically did in this case, happen.
Sir,
It was unexpected.
After the 2 months, why you not?
There's a question over here.
Dr. Richard, there's a...
Please, question over here.
Sepsis, high diabetes, and even a urinary tract infection. Do you believe she should have been brought to the hospital much before than what she was? Did they wait for too long to bring her to the hospital?
So I'm afraid all I can say to you is what I'm aware of after the event. Dr. Babu may be able to comment on the immediate circumstances surrounding her admission, but remember, we in the broader sense, the team at Apollo, were only involved once she reached hospital. But as far as I'm aware, she became short of breath quite suddenly, and the ambulance brought her to hospital quite quickly. But I'm afraid I wasn't there, so I'm only telling you what I know. Just a second.
I agree with Dr. Richard.
In other circumstances, would a patient have been brought earlier?
See, that's you are trying to go ask me to predict the what would happen. It's very difficult to tell. I can only tell you what happened when she came to the. I'm sorry, I'm not able to answer that question.
There are a lot of rumors that are going around. To quell it, இவர் ஒரு நிகழ்வுக்காக இங்க சென்னை வர வேண்டிய சூழ்நிலை இருந்தது. இவர் மோஸ்ட் கிரிட்டிக்கல் டைம்ல இவர் அவங்களுக்கு வைத்தியம் பண்ணதுனால இவர் இருந்து செய்யும் போது இருக்கலாம்ன்றதுக்கு தான் இது to quell all the rumors that are going around.
Dr. Richard,
and that he is around, the expert is around, so we thought this will be the opportune time, in the time correct ah irukum
Dr. Richard, once